Hi, my name is Anna Seiler, and today is February 23rd, 2024, and I'll be giving an informative speech on the risks and consequences associated with using the drug fentanyl. Imagine a substance so potent that merely 2 milligrams could be lethal. To put that into perspective, that is the size of a single grain of sand. That is the deadly reality of the drug fentanyl. Fentanyl is a synthetic opioid that was first made in the 1960s to help patients with chronic pain or patients that had just come out from surgery. It is very effective for these intense pain, hence why it was only given to patients with chronic illnesses or patients that had just come out of very painful back surgeries or very intensive abdominal surgeries because they were so painful. It is a very highly controlled substance because it is so strong, and according to the fentanyl facts on the cdc.gov website, it is 100 times more potent than morphine. If anyone knows about morphine, it is also a very strong drug. It is only given to patients that have gone through very intensely painful things. So, it is also very hard to get morphine now. So imagine how strong that fentanyl is if it's 100 times more potent than morphine. Prescribed fentanyl has very legitimate uses in those medical settings. However, illicit fentanyl is responsible for fatal and non-fatal overdoses in the United States. And it is responsible for those overdoses for many reasons. The first being, unprescribed fentanyl is not safe. Lack of quality control in the labs where the pills are made is not regulated how it is in the United States. These pills are made in foreign labs. Therefore, they do not have the same FDA or other companies regulating how strong each pill is and make sure that every single pill is uniform. So with that being said, when the companies are making these pills, there might be 10 milligrams of the fentanyl to be spread out between 20 pills. However, there's no one there to make sure that when they're mixing up all the drugs, that 9 milligrams goes into one pill and then the other 1 milligram is split between the other 9 pills. Therefore, the potency of all these different pills, individual pills, is very different, and there's no one there to regulate that, which makes that very dangerous for the consumers. According to the fentanyl facts from the CDC, 150 people die per day due to fentanyl overdoses, and it is because these pills are not created equally. According to the Opioid and Fentanyl Awareness Initiative on justice.gov, 6 out of 10 pills tested for fentanyl contained a lethal dose. That is so staggering that you have a 60% chance of dying if you were to take a pill from someone that was illegal. The second reason why fentanyl pills are very dangerous, or just like the rise of fentanyl in our society, is that other drugs are being laced with fentanyl. Fentanyl can be made into a liquid or into a powder, making it very easy to mix with weed, heroin, or other drugs. People are often unknowing that there is fentanyl in their other drugs. They may just be thinking that they're getting straight up weed or the heroin that they've been taking for the past 15 years, but that one time that they get it that is laced with fentanyl, they could die. There are test strips to be able to see if there's fentanyl in these pills. However, it is it takes a lot of time to show up. It takes about 5 minutes for the test strips to show if it's a positive or a negative. And a lot of times people that take the drugs before they do the test strip. So if they do that after, it's totally ineffective and the person could already be dead. They're also very expensive and they're also kind of unreliable. Lacing fentanyl in other drugs also makes these other gateway drugs much more addictive. So if it's laced with a non-lethal amount of the fentanyl, it makes these other drugs much more addictive because it's a stronger fix. And people are going to start taking more of the other drugs or switching to drugs that they know are laced with fentanyl, which is much more dangerous because they need that fix that they were looking for that one time that they got fentanyl in their typical drug that they took. The third reason being the increased strain on hospitals and the healthcare system due to fentanyl. According to the Fentanyl Overdose Data Report on the publichealth.gov website, from 2016 to 2021, fentanyl emergency room visits rose 621%, and from 2016 to 2021, fentanyl hospitalizations rose 225%. Hospitals cannot handle this increase in hospitalizations, especially with the COVID-19 pandemic. A lot of these hospital beds are also very full, and the nurses already have way too much on their plates, in addition to all these other overdose patients that come in. This calls for longer times for ambulance calls and also longer wait times in ERs for other patients. This also creates a need for training for naloxone, or more known as Narcan, which is like the spray that you can use to reverse the effects of an overdose. So today I explained some of the risks and consequences associated with using the drug fentanyl and what the impact it has had on our society. So those three key issues were, the first was the lack of regulation and uniformity in the pills or the other drugs. The second was the issues with lacing fentanyl into other drugs. And the third was the strain on hospitals due to fentanyl. And I hope everyone learned today about the dangers with using fentanyl and the scary truth with that drug. Thank you.